Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Bouchards nodes symptoms causes and treatments. Bouchards nodes symptoms include pain and inflammation. These nodes are bony enlargements of the middle joints of the fingers, also known as proximal interphalangeal, PIP, jointsthe finger joints closest to the knuckles. /r/n/r/n The nodes are a classic sign of osteoarthritis, or joint degeneration, of the hand. They were named after the French pathologist CharlesJoseph Bouchard, who studied people with arthritis during the 19th century. /r/n/r/n Bouchards nodes are less common than Heberdens nodes, which are bony enlargements of the distal interphalangeal, DIP, joints closest to the fingertips. /r/n/r/n Litviniuk Getty Imagesrnrn Bouchards nodes, like Heberdens nodes, may or may not be painful. However, they will typically affect the extent to which a joint can move or its range of motion. /r/n/r/n Over time, this accumulation of excess bone tissue can cause the following symptoms. /r/n/r/n Bouchards nodes are not inherently painful, but will likely increase any pain that occurs with movement. /r/n/r/n The prime cause of Bouchards nodes is the same as any other manifestation of osteoarthritis, the long-term wear and tear of joint tissues. /r/n/r/n Osteoarthritis most often affects the joints of the hands, knees, hips, lower back, and neck. With this very common condition, the cartilage is worn away. Cartilage is the tissue that normally cushions the joint space. /r/n/r/n Common causes of osteoarthritis include /r/n/r/n Joint damage and inflammation can lead to excessive remodeling of bone tissue. Ossificationthe part of the process responsible for bone formationcan can cause nodules to form. /r/n/r/n Risk factors for Bouchards nodes are the same as the risk factors for osteoarthritis, which include /r/n/r/n A Bouchards node is considered a characteristic sign of osteoarthritis, helping differentiate it from other types of arthritis such as gout or rheumatoid arthritis. /r/n/r/n With that said, there are also bumps associated with rheumatoid arthritis and gout. People with rheumatoid arthritis may develop rubbery bumps on the thumb and knuckles called rheumatoid nodules. People with gout may develop crystallized lumps in the joint space called tophi. /r/n/r/n Since there are no blood tests to diagnose osteoarthritis, your healthcare provider may perform other tests to rule out rheumatoid arthritis and gout as causes. /r/n/r/n These include /r/n/r/n A complete blood count, CBC, can be used to measure the white blood cell, WBC, count. Because osteoarthritis is not associated with chronic inflammation, WBCs will usually be normal or near normal. In contrast, they are often elevated with gout and rheumatoid arthritis, which are inflammatory conditions. /r/n/r/n Imaging tests, such as an X-ray to check for joint cartilage loss, can also help confirm the diagnosis. /r/n/r/n Although you can't get rid of Bouchards nodes, you can treat the pain associated with them by managing finger osteoarthritis. The bump itself won't go away unless you have surgery to remove it, but surgical removal is uncommon. It's used mainly for cosmetic reasons. /r/n/r/n The treatment for Bouchards nodes is similar to the treatment approach for hand osteoarthritis without nodes. /r/n/r/n This includes /r/n/r/n Joint immobilization may also be used during acute flare-ups to minimize joint movement. /r/n/r/n Therapy may be needed to improve joint mobility and prevent disability, /r/n/r/n Bouchards nodes are bony overgrowths of the middle joints of the fingers caused by osteoarthritis. They occur when the loss of joint cartilage and inflammation cause excessive bone formation. /r/n/r/n Bouchards nodes may or may not contribute to pain, but typically cause joint stiffness, grip weakness, and misaligned, crooked fingers in severe cases. /r/n/r/n The diagnosis involves lab and imaging tests that help differentiate osteoarthritis from similar conditions like gout and rheumatoid arthritis. /r/n/r/n Bouchards nodes can be treated with rest, ice or heat therapy, pain relievers, or steroid injections if there is pain. Hand therapy can help prevent disability and increase joint mobility. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.